This is your seventh day or
Yes, I had surgery last Thursday.
Thursday? So it's again Thursday. So
Yeah.
7 days complete. Right.
Yeah.
Good. Good. So when did you start taking solids? Yesterday or day before?
Solids I just started taking about an hour ago.
An hour ago. Okay.
Yeah.
So what did you have?
Chapati and some curry.
Have you tried chapati earlier in Japan?
In Japan, yeah, chapati,
Okay.
but more naan bread is more
okay.
popular in the West, I think. But
Okay.
chapati is really
and,
good.
And you had one full chapati or half?
I had almost two.
Two. Oh, I
So,
cannot believe that.
I'm getting full.
We
I'm
need
full
to check
now.
whether we have done a right thing inside or not. So if we look at your barium inside,
Yeah.
this is the contrast study which we have done today. As you can see, your stomach is looking like a tube. This black thing.
Oh, okay.
This is your food pipe, and the diameter of the food pipe and the diameter of the stomach is looking almost the same.
Oh, no.
Stomach was like a big pouch earlier, and now it's a tube.
Right, right.
And if you see, this tube looks like the same as we have in sleeve surgery. Then what is the difference? In sleeve, the patients are not allowed to take solids at least for 1.5 months.
Okay.
And even after 1.5 months, they start with very small bites, and they're not able to take solid food that easily. Like you are taking on day 7, you had 2 chapatis.
Right,
It
right.
seems to be ironical, actually. We have done a bariatric surgery to decrease your diet, but you are taking almost a moderate amount of diet on day 7.
Right, right.
So then how are you going to lose weight?
Right.
So what happens in this mini gastric bypass is, if you look now, this contrast is going down, and here it's entering into the small intestine.
Okay.
So this is the bypass point. Now the food is going down from the food pipe through the stomach tube into the small intestine, and there is no mechanical obstruction on the way.
Okay.
Unlike we have in sleeve or band where the outlet is tight.
Right.
Here the outlet is wide.
Right.
So we would say rather MGB is like making the stomach an extension of the food pipe. So you are actually eating directly into your small intestine. Now, all the food which enters into the small intestine, it will kind of distend, put pressure on the small intestine.
Okay.
So, when your small intestine distends a little, and your brain gets signals from this, and then you feel full. This is the luxury of MGB. There is no mechanical obstruction because there are no rings or no tight outlets like sleeve. But the stomach size has been actually decreased, and it's looking like a tube only.
Right.
You are eating directly into your intestine. So that is the difference. And intestine distends. And once it can distend to a certain level only, because after that you will not tolerate that. It will send signals to your brain that it's full.
Right.
So then automatically you will stop there. So this is called as functional restriction. So this is the main difference between mini gastric bypass and other restrictive techniques like sleeve or band, or even Roux-en-Y, where the outlet is 1.5 centimeters. Here in your case the outlet is 5 centimeters.
Right.
So the difference is you have functional restriction, but in restrictive techniques we have mechanical obstruction. And had I given you a tight outlet or put a band over that, then if you take it even 1 or 2 bites, it will come down and get stuck here.
Right, right,
So
right.
then it'll try to come out. So you have a lot of nausea and vomiting feeling and acid reflux. But with this, because the outlet is wide, and this actually changes the whole scenario.
Right.
I would rather say this is a kind of revolution in bariatric surgery.
Right.
Nobody can believe the patient is eating like this on day 7. And at the same time, you have to lose weight as well. So
Right.
how is it that you will be losing weight? Number 1, because of this functional restriction, you cannot eat this much.
Right.
So you need to go a little bit slow, because MGB would not stop you on the way.
Right.
It will give you a little luxury, like you thought you were full with one chapati, but still you could manage to take 2.
Right.
But
Well, it was
if you
one and
take-
a half.
Yes, 1.5.
Yeah, and
Okay.
I didn't finish the
Yeah.
second one. But,
Yeah.
And
So-
chapatis are people in the West don't know what a chapati is,
Uh-huh.
but so it's nothing like naan bread. Naan bread's like that.
Yeah,
but
yeah. And this is
chapati
small,
is it's really small. So
You can say it's like one piece of simple bread,
right, like
Right.
a really thin, small
really
piece.
thin. Yeah.
And
It's
I could
not
eat
that
like
big.
6 or 7 before surgery.
Before
probably.
surgery, you could
Yeah.
eat that much.
But now 1.5, and
Okay.
I'm done.